Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Identification of Mullarian malformations on hysterosalpingography. If there is only one fallopian, first you will have to see the number of fallopian tubes. If there is only one fallopian tube, then it is unicornuate uterus. If there are two fallopian tubes, then you should check the number of vagina. If there are two vagina or two Leach Wilkinson cannula, then it is a didelphic uterus. If it is a single vagina or single Leach Wilkinson's cannula, then there are two things. One, if it is single vagina, then you will have to, if it is two vaginas or two Leach Wilkinson's cannulas are used, then it is didelphic uterus. If there is single vagina or single Leach Wilkinson's cannula is used, then you should see whether it is a bicornuate uterus or septate uterus. Bicornuate uterus, here in bicornuate uterus, the distance between the two horns is more than 4 centimeters. In septate uterus, the distance between the two horns is less than 4 centimeters. In bicornuate uterus, the angle between the two horns is more than 60 degrees, and in septate uterus, the angle between the two horns is less than 60 degrees.
thank you and thank you for watching.